Gentlelase Pro Alexandrite 755 nanometer wavelengths for laser hair removal. The treatment of vascular lesions and treatment of pigmented lesions. For any laser treatment, it is important to have a complete initial consultation with the patient to review the patient's medical history, including medications. Select the proper skin type of the patient, complete a physical examination, review contraindications, and discuss the treatment process. Establishing appropriate and realistic expectations prior to the treatment is important. The informed consent should be reviewed and signed. Pre-treatment preparations, such as advice regarding sun exposure and post-treatment care, should also be considered and discussed. Please refer to the clinical manual and in-service instructions for a complete discussion of these items. Chapter 1. Laser Hair Removal. The 755 nanometer wavelengths are excellent choices for laser hair removal. The 755 nanometer wavelength has a strong affinity for the melanin in the hair shaft, which transmits heat to the bulb and the bulge of the follicle. All follicles cannot be damaged in one single session as hair grows in different phases: the anagen phase, the catagen phase, and the telogen phase. Each phase has a unique anatomy. In order for the follicle to be optimally damaged, the bulb, bulge, and vascular supply should be present. It is in the anagen phase of the hair growth cycle that the follicle can be optimally targeted. The growth cycle varies depending on which part of the body the hair follicle is found. This is why hair removal requires successive treatments at various treatment intervals. Explaining this to your patients, along with instructions regarding what to expect, how to care for the skin, protect the skin, and remove hair between sessions, will greatly increase patient compliance, treatment success, and customer satisfaction. The next step towards beginning the treatment should be the test spot. Some practitioners prefer to carry these out days prior to beginning the full treatment session. This is especially recommended in patients with darker skin types or under special circumstances such as the use of potentially photosensitizing medication. In these cases, it is best to wait 48 to 72 hours before assessing the skin's response. Before any laser treatment, always make sure the skin is completely clean and there is no sign of any makeup, cream, or deodorant. Residues can lead to burns. The test spot can be used to check the reaction of the skin and also to determine the optimal parameters for treatment. One way to achieve this is to mark off an area and divide it into 3 parts. Select a different fluence for each area, starting with the lowest parameters for the selected skin type. Refer to the treatment guidelines and select parameters based upon the treatment and skin type. In the Pro series, the treatment guidelines are also available in an easy-to-use guided interface. Prior to pulsing the laser, make certain everyone in the room has the appropriate laser eye protection. Be certain that the eye protection has been cleaned between patients. Also be sure that the room is free of reflective surfaces. All windows are appropriately covered, and the door is closed with the appropriate signage. Once the safety of the surroundings has been checked and the parameters have been selected, we will pulse the laser 1 or 2 times in each of the selected energies, and then wait for the skin's response. We look for parafollicular edema in the case of the 755 nanometer laser, which may be accompanied by a mild redness. This is an example of a very strong parafollicular response. A milder variation is also acceptable. Now we can proceed to complete the treatment. For larger zones, you may wish to mark the zones in order to more easily remember which area has been treated. Remember to lower the energy by 2 joules over bony areas. Also remember that areas that have more pigmentation, such as the genital or axillary region, will also require a change in parameters based on the level of pigmentation. Be sure when pulsing near orifices, such as the nose or ear, that they are covered with multiple layers of moist white gauze. Also be certain to avoid lentigos, covering them with white pencil and/or a white paper as needed. Also remember to keep a 1 centimeter distance around tattoos. The long pulsed laser can be used to treat benign pigmented lesions, but never tattoos. Prior to beginning the sessions, you will want to know what the distribution and caliber of the hair is. Once this is determined, it is best to have the patient shave at home 24 to 48 hours prior to the session. There should be little or no hair on the surface of the skin. This is very important for 2 reasons. First, this will allow the skin to recover from the shaving and prevent folliculitis. Second, there will be enough hair growth to see where treatment is needed. Once you begin, remember the distance gauge should be placed flush, perpendicular, and overlapping. Alexandrite 755 nanometer is capable of very rapid treatments from just a single pulse all the way up to 2 Hz. Be certain that as you move the distance gauge across the area, that it is flush against the skin and neither pushing nor hovering in the air. The distance gauge should be perpendicular to the skin and not at an angle. Take care of this especially around curved areas of the body. Also be sure that the distance gauge overlaps approximately 20%. Remember, flush, perpendicular, and 20% overlapping. Let's review the parameter selection. We know the first thing we must carefully select is the phototype of the patient and adjust parameters for bony or pigmented areas. We have also discussed selection of fluents based upon the skin type of our patient and the test spot response. Now let's discuss how we select spot size, pulse duration, and cooling. Spot size selection for hair removal depends upon the depth of the follicle, and therefore the part of the body that is being treated. For deeper follicles found in the body, you will use a 15 or 18 gauge spot size. For more superficial follicles on the face, you will use the 12 gauge spot size. To change the spot size, press the gray side button on the handpiece and move the slider until you have reached the desired size and feel the slider engage with a click. Notice that the silver piece called the slider attachment at the end of the slider is for spot sizes 12, 15, and 18 millimeters, and the gold for spot sizes 6, 8, and 10 millimeters. The piece is easily changed by pulling off the end and replacing it with the desired piece. Make sure once you have selected the spot and calibrated the device that you place the appropriate distance gauge for the spot size selected. Make sure your distance gauge is clean and has no black stain on it. If it is developing black stains, you may clean the end with a diluted bleach solution. Change your distance gauge every 200 to 300 pulses. A clean window and fresh gauge can be quickly and easily attached. Also during the treatment, keep the distance gauge free of any frost from the cryogen by quickly wiping every 30 to 40 pulses. And of course, clean with isopropyl alcohol or medical wipes between patients. Selection of the pulse duration. The 3 millisecond pulse duration is an excellent short pulse duration, especially to remove finer hair. You may wish to leave your pulse duration selection at 3 milliseconds, or in the case of dense hair or thick hair, as in the kind found in a man's beard or the bikini area, you may wish to extend the pulse duration to 10 or even 20 milliseconds, especially during the initial sessions. Extended pulse durations can also provide increased safety for darker skin types. Remember, with darker skin types especially, test spots are highly recommended. Selection of epidermal cooling parameters. The Gentlelase Pro has the option of air cooling or cryogen cooling. For cryogen cooling, parameters should be selected based upon the type of treatment, the spot size, and skin type. Each day, check that the cryogen nozzle is centered and using the cryogen verification form that the distribution of the spray is homogeneous. In this case, we have selected 40 milliseconds of spray with a 20 millisecond delay between the spray and the laser pulse to fully cover the 18 millimeter distance gauge area. After the treatment is complete, you may use cool packs if desired, especially in the case of excessive redness. Otherwise, hydrating the skin with aloe vera gel or topical hydrocortisone and instructing the patient regarding continued hydration and sun protection are important. The following are maintenance tips that are especially important after hair removal treatments. Be sure to clean the distance gauges, inner slider, and window. The distance gauge should be cleaned with alcohol between every patient. Any darker spots can be cleaned with the diluted bleach solution at the end of the day. The window should be changed approximately every 200 to 300 pulses at the same time as you switch out the distance gauge. In order to change the window, simply slide out the window holder and replace the window. All windows and distance gauges can then be cleaned at the same time at the end of the treatment session. It's important to clean the handpiece area that houses the slider by removing the slider and the external window. Clean the inner portion by wiping like this. Be sure to clean the outer part of the slider and check the slider window. This should be done between patients. The slider window should otherwise be removed and cleaned daily. Chapter 2. Pigmented lesions. Prior to treating pigmented lesions, be certain that they have been thoroughly evaluated and are certain to be benign. Remember to follow the guidelines for initial consultation, skin care, and safety as reviewed earlier in the video. Superficial pigmented lesions can be treated with the Gentlelase Pro using the 755 nanometer wavelength, which has a strong affinity for melanin. You can use a variety of spot sizes, depending upon the size of the lesions. You may cover the surrounding tissue in order to protect it. Or you may choose to use a painting technique in the case of a large number of lesions in skin types 1 to 3. In this case, we have chosen a spot size of 8 millimeters. Consult the treatment guidelines for the guided user interface for options regarding spot sizes and energies. Pulse the laser and wait 2 to 3 minutes to evaluate the response. You will see a light frosting and then subsequent darkening of the lesion. This is the ideal treatment response. It is also acceptable to see only a darkening of the lesion. The response will depend upon the amount of pigment in the lesion. For dense and deeply pigmented lesions, less energy will be required, and the response will be more robust. For lighter lesions, more energy may be required. When using the painting technique, first be certain to test a small area in order to check the response of the skin and the lesions before proceeding. If there is no adverse response to the non-pigmented skin, the treatment can proceed. After the treatment, it is important to keep the area well hydrated and protected with sunblock. The lesions will crust and eventually exfoliate. As the skin in the area regenerates, it should be hydrated and protected. The treatment can be repeated in 4 to 6 weeks. Chapter 3. Vascular Lesion Treatment. Vascular lesion treatments can be accomplished with alexandrite 755 nanometer wavelengths. See the clinical manual for a complete explanation of indications and suggested settings. Here we will demonstrate the 1064 nanometer wavelength on leg veins. Leg veins of up to 3 millimeters can be treated. The principal chromophores are oxyhemoglobin and deoxyhemoglobin in the red blood cells. These chromophores are targeted, resulting in the heating of the red blood cells. The heat subsequently diffuses to the vessel wall, and the vessel wall is damaged and collapses upon itself. The vessel is reabsorbed by the body over the course of the next several weeks to months. Again, it is important to review the initial consultation portion of the video to make sure a thorough initial consultation is performed. In the case of vascular lesions, pay special attention to making sure there is no underlying venous insufficiency, which requires previous diagnosis by ultrasound. Also be certain that your patients are not taking medications that will cause bleeding or bruising, such as anticoagulants, aspirin, non-steroidal anti-inflammatories, vitamin E, or ginkgo biloba. Vascular treatments are done using 3 different spot sizes: 1.5 millimeters for facial and leg vessels, 3 millimeters for leg vessels, and the 3 by 10 millimeter elliptical spot for leg vessels. The vascular specialty delivery system must be attached to the device. Select the appropriate spot size slider attachment and attach it to the fiber. The slider is then inserted into the specialty handpiece until the spot is locked into place at the marking SS. The appropriate distance gauge is then attached to the end of the handpiece, depending on the spot size selected. The parameters are selected based upon the size of the vessel. The diameter of the vessel will dictate the pulse duration chosen. Before beginning, make certain the skin is absolutely clean and dry. For smaller vessels, for example those under 0.5 millimeter, a shorter pulse duration of 10 to 20 milliseconds will be selected. For larger vessels, for example those over 1.5 millimeters, a longer pulse duration of 50 to 60 milliseconds will be selected. Start with effluents in the lower range of suggested energies for a given vessel size, and then observe the skin response. Adjust fluents upwards or pulse duration downwards depending upon the response. Be sure to set your DCD cooling. Do not double pulse or overlap. When determining optimal energy settings, if you do not see any response, do not pulse over the same area until 5 minutes have passed and the area is completely cooled. The treatment endpoint is spasm and darkening of the vessel. It is also possible that the vessel will disappear momentarily. Once treatment is completed, follow the post-care instructions found in the clinical manual. Chapter 4. Device Maintenance. The device should be kept in a clean, well-ventilated, temperature-controlled environment. Make sure there is a minimum of 15 inches or 40 centimeters around the device for airflow. In the back of the device, you will find the on-off button, the interlock key, the foot pedal insert, the device filter, and water canister. The water canister should only be filled with distilled or deionized water and should be checked weekly. The back filter is easily removed and cleaned with a vacuum or canned air once per week. The delivery system consists of the electrical cord, the cryogen line, and the optical fiber. It must be handled at all times with extreme care. Make sure the cables are hung and not on the floor. When attaching the delivery system to the device, always attach the optical fiber first, lining it up and pushing. When detaching, release the fiber last by pulling back on the metal portion. To attach the electrical cord, line up the red dot to the red line. When detaching, simply pull back on the metal portion. When attaching the cryogen line, you must push in the metal attachment and insert the line. The metal attachment will spring back, securing the line. To release, once again push in the metal attachment. The valve is under pressure and you will hear a rushing sound. The handpiece components are the filter, button release for slider attachment, inner tube for slider, and window holder. The filter is removed and cleaned once per week. You may wish to do this twice per week with heavy use. The window holder is easy to remove and replace. During longer hair removal treatments, placing multiple window holders at the ready is useful for rapid changing. At the end of the treatment, all windows can be removed and cleaned at the same time. Windows should be cleaned with isopropyl alcohol and a soft cloth, gauze or lens paper. Be careful not to leave a fingerprint by touching the window with your fingers. After each treatment, clean the inner slider area of the handpiece and the outer slider as demonstrated. Check the slider window after each treatment and be sure to clean as needed. If there is any imperfection, change the window. As mentioned earlier, the handpiece windows should be cleaned after each treatment with isopropyl alcohol and soft gauze. Unlike the slider window, they can be used with slight imperfections. To change the cryogen container, separate the clips and remove the container. Empty the container with the cryogen key before disposing of it appropriately. A new container can be kept ready near the device, taking advantage of the warmth emitted by the device. Never actively heat the container in warm water or by any other means. Note that for the specialty delivery system there are 3 spot sizes, the 1.5 millimeter, 3 millimeter, and the elliptical 3 by 10 millimeter. The spot size is chosen by moving the slider along the handpiece. Refer to the user manual when a fault appears. Note that the icon LVM is a portal to information for technical support. This concludes the instructional video for the Gentlelase Pro and Pro Series devices. We hope you enjoy using your device. Thank you from the team at Syneron Candela. Syneron Candela. Science